Let's go now to Dr. Angelique Coetzee in Pretoria, South Africa. She's the chairwoman of the South African Medical Association, and she was one of the first in the country to suspect a new variant was making people sick. Thanks so much for joining us. First of all, what made you suspect that maybe you were seeing or observing another variant?
Good evening, Hola from South Africa. I've been in private practice for 33 years, seeing patients on a daily basis. So my clinical skills are quite developed by this time of at my age group. So what happened is for the past 8 to 10 weeks, we really didn't see any COVID-19 after our third wave with the Delta variant. So subsequently on that day, on the 18th of November, this young man came in, was my first patient of the morning, came in and said to me, "Dr. Luc, I'm not feeling well, I'm extremely tired, and you know, body aches and pains with a bit of a headache." We call it normally malaise in our medical terms. And he couldn't really give me anything more and said, "But you think it was because..." So I went back to the clinical notes and double checked. He said it was because it was extremely hot the past few days in South Africa, and it was working in the sun, and they think it's got to do with, you know, that he was too long in the sun. Right. So it didn't make any sense. A 30-year-old guy coming into you with that type of history. So I did a quick rapid test on him myself, and during the rapid test, you know, he was positive on the rapid test. That was the shock of my life, because I actually didn't expect to get a positive test. And
because of the symptoms, sorry to just jump in so people can follow, but because of the symptoms that you were observing that were not consistent with symptoms that you usually observed in COVID patients, you thought this person is probably COVID negative, and when the COVID test came back positive, you were surprised.
I was so surprised. You really, you know, the first thing that went through my mind was, oh God, not another wave. Because, you know, we have just been through, and I think all doctors will feel the same, you know, it's that PTSD type of feeling coming in and say, not again. So his family also, you know, his wife and one child also had an appointment. I tested them, they were positive, and they had a baby of 4 months old, tested the baby, they asked me to test the baby, and the baby was positive. But that was how it started. So that was how my morning started, a total chaos. So what then happened is during the rest of the day, I saw new patients coming in, you know. I then decided, you know, if you come in and you have just anything remotely viral in your upper respiratory tracts or just something remotely, I will test. And I tested and I found 7 more patients. So because I am part of the advisory committee, and you know, we meet and you know, I'm part of that panel. So I just WhatsApped the guys and I said, listen, something very, very strange happened today. Haven't seen COVID patients. All of a sudden, these patients and this presented to me today. Symptoms not very suggestive of Delta, more of Beta, and maybe a new variant, you know, but no one of us were aware that there is any variant. But simultaneously, in the background, one of the labs, a Lancet lab, one of their technicians also noticed something strange on the PCR testing that he was doing of some other doctor with another patient, and he also alerted them for Julio and his team, and then they looked into all of this. We put the clinical picture together with this, and this is how we say, okay, this is the new variant, because symptoms not similar to the Delta variant. Yeah. And at this stage, clinically, at the primary care level, this is still more or less the picture that we see. Young people coming in,
So
not
just to,
severely ill.
this is fascinating to me, just how you came to this conclusion and how in the laboratory in parallel, there was also the realization that you may be looking at a new variant of this virus. Now, what were the symptoms? Because what you're describing doesn't sound like there's loss of taste or smell. It doesn't sound like there are respiratory issues. You're talking extreme fatigue was the main symptom. And then in younger people as well. So
Yes,
should we see
exactly.
that as should we see that as encouraging that this variant seems to be potentially more transmissible, but not causing the deathly symptoms that require hospitalizations?
So, yes, I think you need to look at it from two ways. The one is to say there's a hype out there. Let us just wait and see what the clinical picture are like. And the other thing is to say to the public out there, listen, if you have this extreme fatigue, this malaise type of feeling, I'm not feeling very well, something is wrong. And the other thing that they also will tell me is that they've got this type of a scratchy throat. It's not a sore throat, it's just a scratch. They call it scratchy. It's very interesting. And a sort of a dry cough, but it's not the same dry cough that we have seen previously. It is like an irritation, not very prominent either. So this is so if you are as a patient or out there are suffering from any of these type of very, very mild symptoms, the idea is please go and get yourself tested.
Absolutely. It's so much to take in. There's so many questions that our viewers will all want to know. So the main one, I think, is if people have been vaccinated, will their vaccines protect them against this new Omicron variant that you have helped identify?
So here's the trick. What we keep on saying, and this is what we say in South Africa, we keep on saying to people, the vaccines are supposed to protect you against severe disease, death, and hospitalization. We tell our patients, it's not going to protect you that well against mild disease. So what are we now seeing at this stage? Remember, it can change going forward because it's early days. But at this stage, this is exactly what we see. Because I have seen patients who have been vaccinated with Pfizer. And most of the very interesting, round about August, the ones that have been vaccinated round about August, it seems to me to be more susceptible of getting infected at this stage. But again, very mild symptoms, the same sort of type of symptoms, and not really feeling very sick. And that's what you want. You want actually that type of profile if you have been vaccinated. You don't want the severely ill patient that is not vaccinated or vaccinated but severely ill. You don't want that.
I've got to ask just this one last question, because you saw how countries outside of your part of Africa have reacted. Travel bans, Japan closing its borders to all travelers, South African travelers banned from traveling to many countries now. Do you think that this is an overreaction then, based on the fact that the symptoms are so mild, and that you in the first place were the ones in South Africa to raise the alarm?
So yes, you have to understand. We say it's early days. We only within the next week or two would we be able to see how unvaccinated people react and how sick they can get as you move into the older groups. But for now, it's predominantly the younger groups, non-vaccinated people. Also important to understand that some of these young people who's what we call public sector patients. In the Baragwanath Hospital, they have seen now quite a few of them coming in. Some of them has been tested today. They tested 14 that was in the normal medical ward for something else, and they just tested positive. So again, not severely ill. They're there for something else. They do have a few patients in the ICU. Also not sure whether that is Omicron or Delta. But at the public-private sector, at Coalface, where we are working, we saw a bit of a different picture regarding, the patients from the street coming in and say, doctor, I'm a bit fatigued. I don't feel well,
Yeah.
just test me now. Because I have heard, doctor, that this is what you are saying out there. And yes, that is what should happen. You should test, but you should never
Yeah,
be
Dr.
lulled into that it's going to be fine.
Dr. Angelique Coetzee, we were so grateful for being able to speak to you this evening. We're very much in a wait and see pattern, but we have the information from you directly, one of the doctors that realized something was going on. And thanks for alerting the world.